So this you have seen already the bones, its identification and site determination. Then you will be having the vessels. Which arteries are present in the lower limb? Which veins and how lymphatic drainage will go? Then the important nerves and the muscles. Muscles will be taken in two different lectures because it is a big topic. Then there is some information about the joints. Okay, so we will provide you with the PowerPoint presentations, and we have tried to include all the information which is expected from you. Okay, if any case you want to use anything else or some more information, you can go to your workbook or you can go to the Clinical Anatomy by Snell. Do you know this book, the Clinical Anatomy by Snell?
Yes,
Yes,
Doctor, we know it.
Yes, yes.
very good. So we have given you much information in the lecture, in the presentations. If any time you get confused or if you want to use any reference, okay, because too much detail is not required from you. Okay, so it is enough you study presentation nicely. Okay, but I will recommend you to go to the workbook before coming to the mashra. So can you see the slides?
Yes.
Yes, okay. So this is the gate one we have already provided you, and you have already studied the bones, okay, in the lab one. So first we will give you orientation about the arteries. So just remember there is only one important artery, which is the femoral artery. And this femoral artery is going to give branches, many different branches at different level, which is going to supply whole of the lower limb. So from where the femoral artery will come? It is a continuation of the external iliac artery. And what is going to happen to this femoral artery? So it will go down to the popliteal fossa. So first we will see about the details of the femoral artery. So as I told you, it is a continuation of external iliac artery. Where this continuation will occur? It will occur behind the inguinal ligament. You remember the inguinal ligament, which will extend from anterior superior iliac spine to pubic tubercle. So from here, this artery will continue as the femoral artery. Finally, it will descend almost vertically. Okay, now here you can see it is going almost vertically towards the adductor tubercle. Okay, so many revisions you will find this landmarks you have seen that where is the adductor tubercle. Yes, do you remember the adductor tubercle? It is present on the medial side of the lower end, just above the medial condyle. So you will try to find out in the lab. So it will descend towards the adductor tubercle and finally it will enter into the opening of the big muscle, which is called as adductor muscle. And what it will become? It will become finally the artery, which is called as the popliteal artery. So here again, you can see this is a femoral artery and this is knee joint. Behind the knee joint, there is a fossa. If you can compare with the upper limb, there were a cubital fossa. Like here, we will have the popliteal fossa. So now this femoral artery will become the popliteal artery here. What are the branches given by the femoral artery? So now is as it is coming from the inguinal ligament, so it will give some branches which is going to supply this region. If you remember, this is a perineal or pelvic region here. Okay, so what are the branches? First of all, superficial and deep branch. Superficially, it will give the superficial circumflex iliac here. Then it will give superficial epigastric, superficial external pudendal. Okay, these three name we know already because it is these are the arteries which is going to supply the perineal region. Then what about the deep branches? So same, you will have the deep external pudendal. Then we will have the profunda femoris artery, and then you will have the descending genicular. Okay, so here just remember descending genicular, it is descending towards the knee joint. Okay, genicular means this is the artery for the knee joint. Then deep external pudendal, obviously it is going to the perineum. Do you remember the word pudendal from the life cycle? In the life cycle, you studied the pudendal canal, pudendal nerve, pudendal artery. So if you don't remember, just write here that pudendal, it is for the perineum. So what is important for us to know is the profunda femoris artery, because this is the profunda femoris artery which is continuing downward. This one. So what happens to the profunda femoris artery? So here the profunda femoris artery, it is the largest branch of the femoral artery. It is going to give medial and lateral circumflex artery. So what about the medial and lateral circumflex? So you can see there is one artery, lateral circumflex, and there is another medial circumflex.
Doctor,
Yeah,
are you in the slide which is arteries of lower limb?
sorry,
Uh, I think the slide is stopped. It's not moving, I guess.
not moving. Okay, you cannot see the slide presentation. Okay, just a moment.
Doctor, we see now the slide which time is, yeah,
Okay,
now it's
okay,
moving, yeah.
okay. Maybe the presentation is not working here, so no problem. I will use this view. So this medial and lateral circumflex femoral artery, they will surround the neck of the femur from the medial side and as well as from lateral side. And then profunda femoris again will give four perforating arteries. So what is the meaning of perforation? Perforation means this artery will pierce some muscle. Then we have next the popliteal artery. The popliteal artery, okay, so we all know it is a continuation of the femoral artery. It will end at the level of the lower border of the popliteus muscle. Okay, so just remember the popliteal fossa is behind the knee joint. Okay, posterior to the knee joint. And in the popliteal fossa, there is a popliteal muscle. And at the lower border of this muscle, our popliteal artery is going to divide into anterior and posterior tibial artery. Okay, which has muscular and articular branches to the knee joint. Now, what will happen to this anterior and posterior tibial artery? So, obviously, anterior tibial artery will be present where? Into the anterior compartment. Okay, it will pierce the interosseous membrane and it will come anteriorly. Then it is accompanied by these arteries, always accompanied by a nerve which is called as deep peroneal nerve. Then it will pass through the extensor retinaculum, and in front here, it will become the dorsalis pedis artery. Okay, this is the artery you can use to check for the pulsation. Okay, if you have the patient of the severe accident, patient, you cannot feel the pulsation on the radial side, so you can use this pulsation. okay, which you will use between these two tendons. So don't worry for this tendon. You will see when you know these muscles. So just remember which artery is this. This is called as dorsalis pedis artery. And this is a branch from which artery? This is the branch from, or this is the continuation of the anterior tibial artery. Here you can see. Then what about the posterior tibial artery? So it is very obvious that posterior tibial artery, it is going to supply the posterior part, okay? And finally, it will divide into medial and lateral plantar artery. It will give one important branch that is called as peroneal artery. Okay. Now see, many times the word peroneal is coming. Peroneal. So this peroneal word is synonym to the fibular. Okay, so whenever the word peroneal is come, think that it is related to the fibula, to the fibular side or to the lateral side. So this peroneal artery will be present laterally. Okay, it is going to give some branches to the tibia, and finally it will become the medial and lateral plantar arteries. Can you see here? These are the medial and lateral plantar arteries here. Okay, this will form the arch here. Okay, like the palm, if you remember in the upper limb also we have studied that there are the palmar arches. Okay, so here we have the plantar arches formed by the medial and lateral plantar arteries. Clear? Here you can see the whole distribution, how it is dividing, and how the anterior tibial artery is present here and the posterior tibial artery present here, which is dividing into medial and lateral plantar branches. How the anterior tibial is continue between the great and the second toe, okay, or between the great and second metatarsals, okay, and will become the dorsalis pedis artery. Then we have the veins. So about the veins, we have superficial veins, deep veins. So no need to worry about the deep vein. Deep vein is the femoral vein. But what about the superficial veins and why it is important to know? Because these veins are superficial, it is related with many diseases, it is related with many surgical procedures. So we have great saphenous vein and small saphenous vein. So this is the dorsal venous arch. Okay. This is the dorsal venous arch, like arterial arch. We have the venous arch also. So this dorsal venous arch has lateral continuation and medial continuation. Okay. So laterally, it will continue as the small saphenous vein. And what is there medially? Great saphenous vein. So small saphenous vein, it will arise from where? From the lateral part of the dorsal venous arch. And it will ascend behind the lateral malleolus. Okay, all of you remember the lateral and medial malleolus? Yes?
Yes.
Yes.
Okay,
Yes.
Yes.
very good.
Yes.
So you have to remember that it is going behind the lateral. These landmarks are very important when you are doing any surgical procedures. Okay, so where it is behind the lateral malleolus. And it is always accompanied by a nerve which is called as sural nerve. Okay, so the small saphenous vein is accompanied by which nerve? Sural nerve. Then what will happen to this nerve when it will go up? So at the middle of the back, you will find that it is going to pierce the deep fascia. Here you can see, sorry. Here you can see this posteriorly. Okay, so now you can see it is going behind the lateral malleolus. Okay, at the middle, it is going to pierce the deep fascia. Then it will be present between the two head of the gastrocnemius muscle. Okay, so here, no, this is about the great. This is the small saphenous vein. So always remember it is going little bit posteriorly because it is going posterior to lateral malleolus. Then what it will do finally? Finally, it will pass between the two heads of the muscle, which is called as gastrocnemius, and it will end into popliteal vein. So it will end into popliteal vein. Here you can see this is the popliteal vein. Okay, so our small saphenous vein is not going too much till the thigh. It will just finish in the popliteal fossa by draining into the popliteal vein. Okay, now what about the grade? Obviously, it is a grade, so it is going to be having a big course. So it will start from the medial end of the dorsal venous arch. It will pass directly upward, where it is in front of the medial malleolus. See the difference. This small is going behind the lateral malleolus, but the great is coming in front of the medial malleolus. And it is also accompanied by a nerve which is called as the saphenous nerve. Then in between, you can see a small course which is going behind the knee joint. Okay, and then finally it is coming in front, getting a curve and coming in front. Yeah, I'm sorry. I think I was out due to some network issue. the video is not working. We could notice your camera. I can't share it. What is the problem? Assalamu alaikum. Can you hear me now?
Alaikum
Alaikum
salam. Yes.
salam.
I'm
Yes.
sorry. I'm sorry. I think I was out due to network issue. So I think you were with me till the varicose vein. Okay, what is varicose vein? It is the problem with the walls of the superficial veins of the lower limb. Okay, if there is a problem, the veins will appear like this. These are the dilated and tortuous veins. Then in brief, what are the lymphatic drainage for the lower limb? We have inguinal lymph nodes. They belong to superficial group and deep group. So in superficial, they are arranged in two types, horizontal and deep. So here you can see you have the horizontal group, which is parallel to the inguinal ligament. Now we know this is the inguinal ligament. So these are the small group of lymph nodes which are parallel to the inguinal ligament. And finally, they will receive the lymph from where? From the anterior abdominal wall below the umbilicus. Same way from the back side below the iliac crest, perineum and external genital areas, except the testes. What about the vertical? So this one is the vertical group, which is along the upper part of great saphenous vein. And this is the groove which is responsible to get the lymph from the most of the lower limb. Okay, the vertical groove. If they ask which groove, you have to tell it is the vertical groove from the superficial inguinal lymph nodes. Finally, all this lymph will go to the deep, and deep will go finally to the external iliac lymph nodes. Okay, so this is about our arteries, veins, and lymph nodes. So is it okay till now?
Yes.
Yes, doctor.
Okay, thank you. Now we have to know about what are the important nerves involved in the lower limb. So first of all, and this is also I'm giving you the orientation of the nerves. Okay, so that whenever you will study the muscle, you should know which nerve is supplying to which muscle, to which group. So we have first is the femoral nerve. Okay, so femoral nerve, obviously it will be along with the femoral artery on the anterior aspect of the thigh. What is the origin? It will come from the lumbar plexus, L2, 3, and 4. Okay, this is the largest branch of the lumbar plexus. Do you remember in upper limb you studied the brachial plexus? It was very complicated. So, Alhamdulillah, you don't have to study the lumbar plexus in detail, but you have to know that which nerves are coming to supply the lower limb. So, this nerve will enter the thigh, okay, behind the inguinal ligament. Okay, so now you can see the arrangement, how it is arranged. This is your femoral artery. Okay,
Sorry, doctor.
yeah, more meat. Yes,
There is no presentation.
no presentation. 1 second. You cannot see the lower limb gate 3.
No.
Oh, yeah. Now, can you see?
Yes.
Okay. So we have first the femoral nerve. So here you can see the arrangement, how it is arranged. Most laterally, we have the femoral nerve, then next artery, then vein. Then what will happen? You can see nicely at this region, just below the inguinal ligament, it is dividing into many small branches. Okay, so first of all, it will divide into two branches, anterior and posterior divisions. So anterior division will have the medial and intermediate cutaneous nerve of the thigh. Okay, and it will give muscular branches to the sartorius and pectineus. Then the posterior division, it will give muscular branches to the quadriceps femoris muscle, and also it will give one saphenous nerve. Can you see the next slide?
Yes.
Yeah. Okay. So this is the origin of the femoral nerve, L2, 3, and 4. Okay. Finally, it has been divided into anterior division and posterior division. Anterior division is giving two cutaneous branches, which is medial and intermediate cutaneous branches, and also one muscle, sartorius. Okay. Posteriorly, remember the quadriceps femoris. We have the group of muscles, quadriceps femoris. Okay. Don't worry for the name of the muscles. In the next slides, you have details. Then next we have the sciatic nerve. So I think this you have studied for the sciatica. The sciatic nerve, it is the largest, okay, this is the thickest nerve in our body, which arises from the sacral plexus. Okay, mainly L4, 5, S1, S2, and S3. What will happen to this nerve? If you see just at the middle of the thigh, at the lower third of the thigh, it is dividing into two branches. One, it is called as tibial, and the another is called as common peroneal nerve. Okay. Now, if you remember just now, sometime back, I told you the peroneal word is related with the fibula bone or to the lateral side. So it means you have one nerve which is called as tibial nerve and one nerve which is called as common fibular or common peroneal nerve. Now, what happened to your tibial nerve? So now just remember the sciatic, it is present posteriorly. We are posterior now. The femoral is at the anterior side of the thigh. The sciatic is at the gluteal region and the posterior aspect of the thigh. So what is tibial now? It is the
Doctor, there is no voice.
so this nerve is present posteriorly and it will pass below the flexure retinaculum and finally it will divide into medial and lateral plantar nerves. What about the common peroneal nerve? So common peroneal nerve, so this is the presentation of the popliteal fossa. Okay, so here you can see these are the two branches, the tibial nerve and the common peroneal nerve. So this common peroneal nerve, it is related with the head of the fibula. And just below, means at the neck of the fibula, it will divide into two terminal branches. Okay, what are these two terminal branches? Superficial and deep peroneal nerve. Okay, superficial and deep peroneal nerves. So we have the common peroneal nerve which will divide into superficial and deep peroneal nerve. So again here you can see this is a common fibular or common peroneal nerve. Some books they refer as fibular, some they call peroneal. Then we have the last nerve that is called as the obturator nerve. Do you remember the obturator foramen? Yes?
Yes.
Okay. So from the obturator foramen, you will see there is a membrane, and from this foramen, this nerve will pass, which is called as obturator nerve. And finally, it will divide into anterior and posterior divisions, which will supply the muscles of the medial compartment of thigh. Okay, so these, in short, these are the nerves which you will see that it is supplying the muscles of the thigh and leg region. Now we will see some muscles. Okay, so it is not very complicated like the upper limb, because here the muscles they are arranged in groups. Their actions generally are similar. Their nerve supplies are also similar. Okay. So first of all, we have the muscles of the gluteal region. Okay, the gluteal region means the buttocks where you are sitting. So we have three important muscles in the gluteal region. Gluteus maximus is the bigger one. The gluteus medius, then we have the gluteal minimus. Then there is a muscle fibers which will be attached to the fascia, which will be attached to the deep fascia. It is called as tensor fascia lata. Okay, the tensor fascia lata, is it a muscle? Yes, it is a muscle which will be attached to the deep fascia, which will tense the deep fascia. Then, if you remove these muscles, if you cut maximus, medius, minimus, you will find that there are some small muscles. They are called as piriformis, gemellus superior, gemellus inferior, obturator internus, and quadratus femoris. And what is the common about these short muscles? That they all are lateral rotators. Okay, they all are lateral rotators. So before that, I will show you something. This is a gluteal region. This big muscle, it is called as gluteus maximus. Okay, so when you remove this gluteus maximus, you can see that there is another muscle, gluteus medius, which is also removed here. Then we have the gluteus minimus. Okay. Then there is another muscle which is called as piriformis. Below the piriformis, you have the gemellus superior and gemellus inferior. Okay. And between them, there is the obturator internus muscle. Gemellus means the in pair. Okay. They are in pair. Two muscles, superior and inferior. And in between these two muscles, there is obturator internus. Okay. And below this here, you can see a muscle which is rectangular in shape. It is called as quadratus femoris. Okay. This is the structure when you will cut the gluteus maximus and medius. Okay. Here you can see that maximus is a very, very huge muscle taking origin from the bone, okay, from the ligaments of the sacrum, also from the sacrum. So, as if you do dissection, suppose you cut the skin of the thigh region, you will see that there is a deep fascia like this. Can you see this covering of the green? So when you remove the skin, you will see there is a thick deep fascia. Okay, this deep fascia, it is called as fascia lata. Okay, so what is the fascia lata? It is a deep fascia of thigh. Okay. Then you will see that this deep fascia is more thick here, medially. Okay, which will be attached to the iliac crest to tibia. Can you see this white line, this white fascia? So this is also a part of deep fascia, which is attached from the ilium to tibia. It is called as iliotibial tract. What is it? Iliotibial tract. So let us come back to our muscles. So if you remember, when we saw the hip bone, we saw that the outer, the lateral, or the external surface of the ilium, it is called as the gluteal surface, which is going to give origin to all the three gluteal muscles. Okay. And then finally, what will happen to the gluteus maximus? Yes, some fibers of the gluteus maximus will be getting inserted over gluteal tuberosity. You remember the gluteal tuberosity? Yes, everyone?
Yes.
Yes,
Yeah,
sir.
Yes.
below the, yeah, very good. Below the greater trochanter, we have the bony, small bony elevation, which is called as gluteal tuberosity. This gluteal tuberosity is for which muscle? It is for the some fibers of the gluteus maximus. Okay. Then what about the medius and minimus? They will be inserted over the greater trochanter of the femur. Okay. So this is a chart which is showing the origin of the gluteus maximus, which is from the outer surface of ilium. As we know, it is a big muscle, so it will come from sacrum, coccyx, and also the ligaments of the sacrum, which is called as sacrotuberous. Okay, what is the insertion? Yes, some fibers will be inserted over the gluteal tuberosity of the femur, and some fibers they will be attached to the iliotibial tract. What is the nerve supply? It will be supplied by the gluteal nerve. We have two gluteal nerves, superior and inferior. So the gluteus maximus is supplied by the inferior gluteal nerve. Okay, what is the action? Extension. This is the chief or main extensor of the hip joint. Okay, and also it will do the lateral rotation. What about the medius and minimus? Easy, they will come from the outer surface of the ilium, and finally it will be inserted over the greater trochanter. The nerve supply is same, superior gluteal nerve. Okay, just remember the maximus has different nerve supply, different action. But medius, generally, they will have the same nerve supply, same insertion, and they both will do abduction. Okay, they are responsible for the abduction and medial rotation of hip joint. Then, as we are talking about the tensor fascia lata, so it will come from iliac crest, inserted over the iliotibial tract. What is the nerve supply? Superior gluteal nerve. It will help in extension of the knee joint. Okay, along with what? Along with the gluteus maximus. So again, we will see these muscles. This is the gluteus maximus. Now you can see this is the, as I told you, this is the iliotibial tract. Very easy. Coming from ilium, tubercle of the ilium to the tibia, a thick deep fascia, which will also receive the two muscles, which will receive the some fibers. Can you see some fibers of the gluteus maximus? Here you can see nicely that some fibers of the gluteus maximus, it is going to the iliotibial tract. And the some fibers, they are attached to the gluteal tuberosity. Okay, this picture is showing you the insertion of the gluteus maximus in two forms. One to the gluteal tuberosity, another to the iliotibial tract. So this is the area, or this is the region where you can give the intramuscular injection. Okay. Now, if you see that in this area, we have many important nerves and vessels like the sciatic nerve. So for this region, for this, which region is free of important structure? So it is your upper outer quadrant, this one. This area, it is the safe place to give the injection to avoid injury to the important structures like sciatic nerve or other vessels. So now this is a normal gait. Okay, normally when you raise your foot, okay, what will happen? The same pelvis will go up, right? And the another side will just dip. Okay, like synchronized movement. If this is your left foot or your left lower limb, so if it's moving up, okay, so this another side will balance. Okay, so you will not feel that the iliac crest is going up and down. Okay, why? Because when this part is little above, this will make the balance. Okay, but suppose there is a problem. Okay, suppose there is a problem. So what will happen? You are walking, your left foot is up. So instead of going to upside, your hip is going down. Okay, so where is the problem? The problem is the contralateral side, opposite side. Okay, because the opposite muscle is not keeping your iliac crest down. Okay, so don't worry for this. When you will come to the lab, you can just try with this. This is the normal movement. Okay, this will happen when you have both your gluteus medius, right and left, normal. Okay, so when you raise your foot, your hip will go little above and it is balanced by the opposite side. But if there is a problem in your opposite, this sided abductors, what will happen? Yeah, it cannot balance and it will take your hip down. Again, okay, this is a normal phenomena. Normally, the person is walking. So here, your gluteus medius and minimus, it is keeping your hip bone, or you can say your pelvic, in the equilateral position. Okay, there is little up, down. So balance. But if there is the weakness of the gluteus medius here, at the opposite, contralateral means opposite side. So your pelvis will drop. Okay. So the patient will be present with the Trendelenburg gait, which is dipping gait. And this will happen in unilateral lesion. Means if there is a problem on the right side, it is the Trendelenburg gait. So when the person will take the normal leg up, his pelvis will be dipping down. So it is called as dipping gait. But if suppose both the gluteus medius are not working properly, so it is called as waddling gait. Okay, so maybe you can try, and when you will see some more form of gait, you will be understanding this. What is dipping gait? Dipping gait means unilateral region. Waddling gait means bilateral region. Okay, it can happen where? First of all, if there is a problem with the abductors like your gluteus medius and minimus. Okay, so what is the nerve which is supplying these two muscles? So you should know that it can happen if there is injury to your superior gluteal nerve. Okay, because your superior gluteal nerve is supplying to these muscles. So this type of gait can happen in the gluteus medius and minimus muscle injury, even the superior gluteal nerve injury. And the other causes also includes the dislocation of the hip and myopathy, the problem with other muscles. Okay, we have the other small muscles of the gluteal region. So don't worry for its origin and insertion. Okay, you have to know the nerve supply action. But in short, I will tell you the piriformis. Okay, it will come from sacrum. It is inserted over the greater trochanter. Obturator internus. So we know now the obturator foramen. So from the inner surface of the obturator membrane, this muscle will come. It is also inserted over the greater trochanter. Gemellus superior and inferior, it will come from the ischium. What is the insertion? Greater trochanter. Okay, the quadratus femoris, it is coming from the ischial tuberosity. What is the insertion? Quadrate tubercle. Do you remember the quadrate tubercle? Over the intertrochanteric crest, the posterior part of the two trochanters. Okay, if you don't know, okay, no problem. You can see in the next lab. So in general, if you see, all these muscles are inserted over the greater trochanter, right? And this quadratus femoris is attached to the quadrate tubercle, which is below the greater trochanter. So just remember, when these all muscles will contract, they will take the hip to the outer level, means they will do the lateral rotation of the thigh at the hip joint. Okay, so what is in general, what is insertion at the greater trochanter? So what they will do together, they will do the lateral rotation. Okay, what is the nerve supply of all this? See, it is almost common. Only the piriformis, which is taking from the first and second sacral nerves, they all receives the nerve supply from the sacral plexus. Okay, so I will not you to force to remember everything, but at least you can remember the action, you can remember the nerve supply. So this is the gluteal region. When you remove the gluteus maximus and medius, you can see this is a piriformis muscle. This is also called as key muscle. Okay, because above and below this, you can see there are important structures. Okay, there are important nerves which are mostly below. Do you remember this, the greater sciatic foramen, lesser sciatic foramen from the life cycle?
Yes.
Okay. So now we have the compartments of the thigh. So how the thigh is divided? The thigh is divided into three compartments. Very easy. Okay, very easy because they have the common nerve supply, mostly common action. So we have the anterior compartment, the posterior compartment, and the medial compartment. So this is the anterior compartment. What are the muscles you can see here? So we have a muscle which is called as psoas major. Okay, the psoas major, it is coming from the trunk. If you remember in the abdomen or maybe in the life cycle, you studied that these muscles will come from the lumbar vertebrae here. Then we have the iliacus muscle. What do you know about the iliacus muscle? That it will come from the iliac fossa. Okay. Then we have a pectineus muscle. Then there is a big muscle which is called as sartorius. Finally, we have the quadriceps femoris. Okay. So here this group of muscles, they are supplied by femoral nerve. Okay. All these muscles, they are supplied by femoral nerve. except the psoas major, which will be supplied by lumbar plexus. Why? Because it is coming from above. It is coming from the lumbar vertebrae. Okay, so here you can see the iliacus muscle and psoas major muscle. Okay, they will come from different origin, but they will make a common muscle called as iliopsoas. Okay, and they will be inserted over the lesser trochanter. What do you call it? Iliopsoas. And this is the chief or important flexure of the hip joint. Are you with me? Yes?
Yes, doctor.
Yes, doctor.
Okay, so if you have any problem, any difficulty, just you can ask. I know this is a different time. Maybe you are completely involved in neuroanatomy, neurophysiology, and suddenly you have to study lower limb, right? But I'm trying to make you so that when you come to the mashra, you can identify all. Okay. So this is a muscle, psoas major and iliacus, which forms the iliopsoas. And this is the important muscle for the flexion of the hip joint. Right? Do you remember in the previous slide, I told you one important muscle for extension of the hip joint? Yes? Any idea?
Gluteus maximus.
Very good, very, very good. So you have the gluteus maximus, which is chief or important muscle for extension. And along with this, there is a very small muscle which is called as tensor fascia lata. This will help the gluteus maximus in extending the knee joint. Okay. So now you know which is the chief muscle for extension, what is the chief muscle for flexion. Okay. Now you know the lateral rotators also. Okay. So we have what is the nerve supply for the anterior compartment of the thigh now? Yes. Which is the nerve for the anterior compartment of thigh?
Femur
Finger
nerve.
nerve.
Very good. It is a femoral nerve. Okay. And what will be the action for the anterior compartment of the muscles of the anterior compartment?
Flexion.
Mostly if you see they are the small muscles. Okay. They will do the flexion of the thigh. Okay. But if the muscle is big, if it is crossing the knee joint, the action will be different. Okay. So we will see the iliacus, which is also a short muscle coming from iliac fossa inserted over the lesser trochanter. Psoas major, it is coming from the thoracic and lumbar vertebrae. Okay, along with the iliacus, it is attached to the lesser trochanter. Okay, so they both are responsible for flexion of the thigh. Okay, what about the sartorius? Okay, if you see the sartorius, it is a very long muscle. It is crossing the hip joint and as well as the knee joint. Okay, it takes origin from the anterior superior iliac spine. Okay, you can imagine that it will cross. Okay, so where is the anterior superior iliac spine here? Here. It is taking origin from anterior superior iliac spine. From the, you can say this is lateral side. Then it will cross. Okay, you can see it is crossing the thigh. And now it is going to insert over the medial side of the tibia. So it is crossing your hip joint as well as your knee joint. So what it is going to do? Same. It is going to do the flexion at the knee. It also acts as the abductor and lateral rotator. Okay. And it will also do the flexion and medial rotation of the knee joint. So it has action at both the joints. Okay. It will be helpful for the flexion of the hip as well as for the flexion of the knee joint. Okay, so here you can see that now if you remove all the muscles, you have this quadriceps group. Okay, you have removed, now you cannot see your other muscles, right? You cannot see here the sartorius, okay, the pectineus and all. But here you can see that this is a cut part of the sartorius. So if you cut here, you can see there are 4 more bulky and bigger muscles. They are called as quadriceps. So what are the muscles included in quadriceps? So you have first the rectus femoris, then 3 vasti: vastus lateralis, vastus medialis, and vastus intermedius. Okay? Rectus femoris, vastus lateralis, vastus medialis, vastus intermedius. So if you see, they all are coming from the shaft of the femur. All the 3 vasti, they will take origin from the shaft of the femur. But rectus femoris, it has 2 heads. Okay, it will come from the ilium, okay, anterior inferior iliac spine, and also another head from the acetabulum. Then finally, why they are called as quadriceps? Because they all will form a common tendon, okay, which will be attached to the patella, and then through the ligamentum patelli, finally it will be attached to the tubercle of tibia. You remember the tibial tuberosity? Okay, so this is a quadriceps muscle. This is the tendon of the quadriceps. So first it is attached to the patella, you can see. And from patella, you can see it is attached to the tibial tuberosity through this ligament, which is called as patellar ligament. Okay, so obviously the insertion will be same for all the 4 muscles. Okay, what will be the nerve supply? As we know, the femoral nerve, it is the nerve for anterior compartment. Okay. And these muscles, as we know, these 3, they are coming from the shaft of the femur to tibia. So they all act on the knee joint as the extension of the leg at the knee joint. And the rectus, as it has the origin from the hip, so obviously it will act on the hip joint. Okay, so it will do the extension of the leg at the knee joint and flexion of the thigh at hip joint. Okay, so this is the quadriceps tendon. So this is patella. From patella, you can see this is patellar ligament, which is attached to the tibial tuberosity. So we have some good specimen, the original specimen, where you can see these muscles. Okay. Then the muscle arrangement of the upper part of the thigh is in such a form that it will form a triangle like this. Okay, this is a muscular triangle which is formed by the muscles. Okay, it is important to know why, because it has very important structures like femoral artery, femoral vein, femoral nerve. So what are the boundaries for this triangle? Laterally, you will have, this is the lateral border which is formed by a muscle, big muscle called as sartorius. Okay. What about the medial boundary? So medially we will have, now we will see, we have the adductor muscles, adductors. Okay, they are going to do what? Adduction. So we have the lateral border by the sartorius muscle. Medially we have the adductor longus muscle. Where is the base? This is the base which is formed by the inguinal ligament. Where is the apex? It is the meeting point of the lateral and medial border. The roof will be formed by the skin and fascia. So when you will cut the skin and the fascia, you will see this type of triangle, okay, which has sartorius, adductor longus, and inguinal ligament as the boundaries. What are the contents present here? First of all, you have the femoral nerve, more lateral. Do you remember? Just now we saw the sequence. Nerve is more laterally. And there is a femoral sheath. Okay, so femoral sheath, it is a covering of the fascia, which has femoral artery, femoral vein, and deep inguinal lymph nodes. Here you can see. Now, if you see carefully that this is a femoral sheath which has three small compartments. Okay, first is for the artery, second is for the vein, and third, which has the lymph node, is looking almost empty. Okay, so this is called as femoral canal. Okay, which is the medial part of the femoral sheath, and here its opening, it is called as femoral ring. Okay, so what is the importance? Because this is almost empty space. This is the common site for the hernia. You know hernia now? Yes? Any idea what is hernia? No?
Herniation of the small intestine.
Very, very good. So here you can imagine, because in female the pelvis is wider, so this space will be wide. Okay, so in old age when the muscles become weak, okay, or maybe after multiple pregnancies, what will happen? There are chances that the intestine may go through this canal. Okay, so this is called as femoral hernia, which can happen through the femoral canal. Okay, and this is one of the common hernia in females due to the wider pelvis. So now we have this triangle clear, the boundaries and contents. Now what you should know that this triangle has four muscles in its floor. Okay, first of all, we have the iliacus, psoas major, then pectineus, then adductor longus. Okay, so I will suggest you, when you see the specimen, try to identify first which muscle, iliacus. Okay, if you identify iliacus, because iliacus is coming from the iliac fossa. So very nicely you can see in your specimen that iliacus muscle is present in the iliac fossa. Then next to iliac fossa, there is a friend of iliacus muscle which is running with it always. It is psoas major, which is called as iliopsoas. So first, which muscle you will try to identify? Iliacus. Okay. Then next to this will be psoas major. Next to this will be pectineus. Okay. Then you will have the adductor longus. Okay, why I'm telling you like this? Because if you try to find the sartorius in some of the specimen, they have cut the sartorius to show you the other muscles. Okay, so always what you will search first? Iliacus. If you know iliacus, then you will search for the friend of iliacus, psoas major. Then next, pectineus. Like this, you can continue and will be able to identify the muscles. Now there is one more hidden story here, is that this is the sartorius muscle, which is a long muscle, right? So here this is apex of the femoral triangle, which will finish here. But when you will cut this sartorius muscle, okay, when you will cut this sartorius muscle only in this part, you will see that there is a small canal like this. Okay, this is a sartorius muscle which is cut in the lower 1/3 part. Okay, and here you will see that this at the middle part of the thigh, there is a canal which is called as adductor canal, subsartorial, or hunter's canal. Okay, this is a tunnel in the middle third of the thigh. Anteriorly, you will find the sartorius. Okay, means you can say when you remove the sartorius, then only you can see this. Then posteromedially, here you will have the adductor longus and adductor magnus muscle, and laterally this is the vastus medialis. Okay, why it is important to know? Because it also contains some important structures like femoral artery, vein, lymph vessels, saphenous nerve, and nerve to vastus medialis. Okay, but you will ask, where is the femoral nerve here? Is it present? No. Why? Because the femoral nerve is already divided into anterior and posterior divisions and its branches in the femoral triangle. So it will not come into the adductor canal. Only the branches of it will come, which is the saphenous nerve and nerve to vastus medialis. Okay, till now. So in practical, what you are supposed to see, here you can see the gluteus maximus muscle. Yes, it is present. Gluteus medius. Yes, it is present. Then you can see anteriorly the femoral triangle, all the muscles of the femoral triangle. Then you can see obviously the quadriceps muscles, which are also present in our specimen. Then we have the medial compartment. So easy again. The medial compartment will be having which nerve? Can you imagine? Can you guess which nerve will be present medially to supply the adductor muscles?
Obturator.
Very good. It is the obturator nerve. Medially, we have the 1, 2, 3 adductors: adductor longus, adductor magnus, adductor brevis. Then we have more superficial muscle, which is called as gracialis. Okay, in some specimen, you can see or may not be, but longus, magnus, and brevis is present. Then we have the obturator externus, which will come from the outer surface of the obturator foramen. So very easy if you want to know what is the origin. So obviously all these muscles will come from this area, from the pubic bone, maybe the body, maybe the ramus. Okay. Now, can you see where these muscles are going to get inserted? They are going to the, you can say, medial or posterior aspect of the femur. Okay. Okay. So here to see this muscle, we have cut all the anterior compartment muscle, right? All the muscles of the anterior compartment have been inserted and here you can see can you see the slides?
Yes, doctor.
Yes, okay. So now if you see in this magnus muscle, you have the perforations. Okay, you have the openings. So these are the openings for the perforating arteries. Okay. If you remember in femoral artery, we saw that it gives the perforating branches. Okay. And if you remember in the femoral artery, we saw that it will go till the adductor tubercle, right? So this opening, this is the hiatus or opening for the femoral artery. In which muscle? In the adductor magnus muscle. Into the adductor magnus muscle. Okay, so again, I will repeat for you. You have the brachialis, which will be more superficial muscle. Okay, we have the adductor longus, which is long muscle. Adductor magnus. Magnus means it is a huge muscle. Okay, it is huge. It has many perforations for the branches of the femoral artery. From the large perforation, even the femoral artery will pass. Then we have the adductor brevis. What is the meaning of brevis? Anything brevis means short. Okay, short, small. Then we have the obturator externus muscle. So here you can see from the opening of the adductor magnus, you can see how the femoral artery is passing. Okay. Then here we have the obturator externus muscle, which is coming from the obturator membrane. So this is in short, it is showing you all the muscles. So don't worry for the origin and insertion. Because in general, I have told you all these muscles will come from the medial side, like pubic bone, okay? And from the obturator membrane. And also this from the inferior ramus of the pubis and ischium. Okay? What is the insertion? It will be inserted over the shaft of the tibia. The adductors, so if you remember just now we saw that they are going to the posterior side. Okay, so posteriorly they will be inserted where? Towards the linea aspera. What is linea aspera now? It is the posterior thick border of the femur, okay, which receives and gives attachment to most of the muscles of the medial and posterior compartment. Okay. What is the noun? So very good. All of you know it is the obturator now. Okay. What will be the action? Adduction. Okay. Only the obturator is externus. It is a small muscle responsible for retrorotation also. Now, can you find that there is something different with the adductor magnus? Okay. Even if you see its origin, it has two origin. One, which is from the medial compartment from the pubic bone. Another is from the ischial tuberosity. Okay, even it has two nerve supply. Obturator now, because it is from the adductor compartment, and it has the sciatic nerve because it belongs to hamstring muscle also. Okay, so adductor magnus, it is a huge muscle. It has two origin. One from the pubic bone, one is from the ischial tuberosity. So this muscle belongs to not only from the adductor compartment, also from the posterior compartment. Okay, means you can write here that it belongs to the medial as well as the posterior compartment. Okay, because it has two heads coming from two different bones, ischial and pubic. Two nerve supply, obturator and sciatic. Okay, easy inshallah. Don't worry for the origin and insertion. But why I'm telling you in broad, so when you will see the muscle, at least you will have the broad concept that yes, this muscle is coming from this side and you can identify. Okay. Now we have the posterior compartment muscle. So this is also easy because they all will take origin from a common origin. What is that? Tibial tuberosity. Okay. And insertion, you will find it is attached posteriorly. Okay, and some muscles will go down also. We will see that. What do you think? What will be the nerve of the posterior compartment? Any
Sciatic.
idea? Very good, sciatic nerve. Okay. So what are the muscles of the posterior compartment of thigh? They are called as hamstring muscles. Okay. If you go to the gym, if you are regular in the gym, or if you are doing exercises, you must be knowing what is quadriceps, where is the hamstring, because you have to work on these muscles to get more strong body, right? So we have the hamstring muscles which are present posteriorly. Okay. So in this picture, if you see, you have cut the gluteal region completely. There is no gluteus maximus, medius, or minimus. Okay. Only you can see some small lateral rotators, and this group of muscles which is coming from a common origin which is called as ischial tuberosity. Okay. But if you see lower down the insertion, no, insertion is not common. Okay. So what are the muscles in the hamstring group? Biceps femoris. Okay. If you remember the biceps in the upper limb, it was biceps brachii. Now it is biceps femoris. Semitendinosus. Okay. Semimembranosus. Then we have the hamstring part of adductor magnus. Just now we saw that adductor magnus has two origin, two nerve supply. So all these muscles will be supplied by the tibial portion of the sciatic nerve. What they are going to do action? The flexion of the knee joint. Easy? Can you imagine how they are going to do flexion of the knee joint? Right? All of you? What are
Yes.
the muscles? Yeah, very good. What are the muscles going to do extension of knee joint? Extension of knee. Muscles of anterior compartment of thigh, like quadriceps. Flexion, posterior compartment, like hamstrings. Okay. So what is important here is the to know about the biceps femoris. Biceps means two heads, long head, short head, like upper limb. So here you have to know that the short head of the biceps has different nerve supply, which is by the common peroneal nerve. Okay, so very easy. The origin similar, but only there is some twist with the biceps femoris because it has two heads. Long head will come from ischial tuberosity. Short head will come from the linea aspera. Okay, and lateral supracondylar ridge of shaft of femur. Okay, what is the insertion of the biceps femoris? So this both the heads will be inserted to the head of the fibula. Okay, so by this insertion, you should know that the biceps is the lateral muscle. Okay, when you will see the specimen, if you see a muscle which is laterally, okay, you will say it is a biceps femoris. Okay, even you can see nicely the two heads in the specimen. Nerve supply, the long head is by the tibial part, the short head is by the common peroneal part. Okay, they are responsible for the flexion, and as it is present laterally over the fibula, it will do lateral rotation as well. Okay, then we have the semitendinosus. Semi means half. This muscle will be half tendon, half muscle. Okay, semimembranosus means the half muscle and half flat membrane. Okay, they will come from the ischial tuberosity inserted over the shaft of tibia, and also this is going to the tibia. So these are the long muscles. Okay, one is going to the fibula and Another, these are going to the tibia. So it means semimembranosus and tendinosus will be the medial muscle. Okay. And biceps will be lateral muscle. If you want to note down, you can note down so that you can identify easily. Nerve supply, clear, tibial portion of sciatic nerve, tibial portion of the sciatic nerve. Flexion, as it is present medially, it will also do the medial rotation of the knee joint. Okay, because they are coming from the ischial tuberosity, so it will be having the action at the thigh or hip joint also. Now we have the last muscle, adductor magnus, which has the hamstring part and as well as adductor part. So this part will take origin from the ischial tuberosity. Where is the insertion? Over the adductor tubercle of femur. Do you remember the adductor tubercle? Yes, because many times we are talking about the adductor tubercle. Yes, it is over the or just above the medial condyle of the femur. Okay, and it will receive the insertion of the adductor magnus muscle. Okay, so it has the nerve supply by the tibial part of the sciatic nerve, and it will help in the extension of the thigh at the hip joint. Okay, are you with me or sleeping?
We are ready.
Okay,
With you, teacher.
so I hope it is not too much for you, but it is more easy than the upper limb because you have to just remember the group. Okay, it's nerve supply, it's action. Okay, and you have to identify these muscles. So will you be able to identify these muscles in the lab, inshallah?
Yes, inshallah.
You will try. So inshallah you will try to read this before the lab, and if there is any difficulty you can ask me. Okay, do you want me to repeat anything now itself? You want me to ask anything, any questions?
Doctor,
Yes, please.
I want to ask you about slide number 31.
Yes, this one. Yes.
Where is the anterior and lateral border?
Okay. So anterior border is the this one, which will be formed by the sartorius. Okay. And this is the lateral, which will be formed by see, if you take the orientation, look carefully. This is the medial side of the thigh, right? So obviously this will
Yes.
be lateral side. Okay. So this is medial side. This is lateral side. Okay. And this will be the anterior part. Okay. When you are standing, what is more anterior? Sartorius muscle. Right?
Yes, Doctor.
And this is, yeah, this is the laterally where you have the vastus muscle, vastus medialis. Okay. And there you will be having the adductor muscle. Okay. Again, oh, this four, how you will try to identify the four quadriceps muscles. Okay. So first of all, I will give you orientation in the center. This is the center. Okay. So in the center, you will be having the rectus femoris. Okay. In the center, what is there? Rectus femoris. Medial to the rectus femoris, you will see these fibers. Vastus medialis. Laterally, vastus lateralis. Okay. In the center, what is there? Very easy. Which is going till the patella rectus because it is straight. Rectus femoris. Medially, vastus medialis, laterally, vastus lateralis. Then what about the vastus intermedius? So when you just remove the rectus femoris or just try to take it little up, you will see a deep muscle which will be the vastus intermedius. Okay. So like this, you can identify these 4 muscles. Okay, anything else? Okay, so just give some time. Whenever you are coming to the lab, just read once. I don't want that you should know everything. At least you should know something so that you can try to identify. Okay, and if you don't understand, you can again ask in the mashrab. Okay, don't be hesitant. You are always free to ask anything. Okay,
Thank you.
thank you so much. Okay, see you in the mashra, inshallah.